Welcome to Brain Bites, the bite-sized neuroscience podcast of the Ascend program, advancing STEM community engagement through neuroscience discovery. We're your hosts. I'm Dan Nemeth.
And I'm Dr. Lorena Areal. Brain Bites is a show designed to guide people of all ages through the mysterious, complex, and exciting world of neuroscience in short, digestible episodes.
Hey, Lorena. Welcome to the show.
Thanks. I'm so excited to get started talking neuroscience with you.
Yeah, I'm glad you're here with us too. Tell us a little about yourself.
Okay. Well, I'm a neuroscientist at the Florida Atlantic University Brain Institute, and I research how chemicals in your brain called neurotransmitters are regulated, and then how they can cause brain disorders and change your behavior when they're not functioning properly.
What kind of disorders would we get if our neurotransmitters aren't functioning properly?
You can get disorders such as ADHD, probably heard about that before, anxiety, depression, schizophrenia.
So your work is like super important. That's, all these things are mental disorders that we deal with on a daily basis. And maybe some of our listeners might have ADHD. They might be suffering from anxiety or depression. So I think
Exactly.
It's great.
Or someone in their families. It's important for the families to learn about these things so we can help them deal with these family members, right?
Yeah. I think knowing a lot about these topics of neuroscience when it comes to having family members that might be, or yourself might be suffering from, or dealing with I guess one of these disorders, it's great to have a little bit extra knowledge. So that way it seems less daunting. You can at least know a little bit more about it.
Yes, exactly.
And so, we have Lorena with us today, and she'll be with us for the rest of this year. And it's sad to say that Dr. Melissa Borgen will be moving on from the Ascend program. She got a great new job. So hopefully you'll hear from her in the future. But for now, we have one of my new co-hosts, Lorena, and I'm excited to have her so we can create some great neuroscience content for everyone.
Yay.
Okay, Lorena. Whoa. Don't move.
Oh no. What is it?
I got it. How long were you keeping this quarter behind your ear?
Whoa, where did that come from?
I'm not going to tell you. A magician never reveals his secrets.
Let me see that.
You'll have to find it first.
Oh my gosh, where did it go?
Well, I'm using magic.
Okay. Seriously though, how did you do that?
Okay, I'll spill the beans. I'm using a sleight of hand or illusions to trick your brain. Illusions are the basis of many forms of magic.
Illusions? What's that?
Well, an illusion is a distortion of your senses. Basically, your senses are working perfectly correctly, but your brain isn't able to decipher what's actually going on around you. And it appears to change your perception of the world around you. Remember our senses episode from earlier?
Yeah, Dr. Borgen and you talked about how your body takes in information into your sensory organs, and then your brain processes it so you can experience specific parts of our environment.
Yeah, so for our listeners, if you haven't heard our 2-part senses series, go back and check that out. They'll cover everything from taste to smell to touch to sight. And we have many senses. Some will detect physical stimuli like light and sound and touch, and some detect chemical senses like taste and smell. To detect our physical environment, we use our eyes, ears, and skin, and to detect our chemical environment, we use our tongue and our nose.
Okay, so I'm confused. Do illusions mean that there's anything wrong with our senses or not? Because I totally saw that quarter appear and disappear into thin air.
That's a great question. And no, you're totally fine. Don't worry about it. Your senses are working exactly how they're supposed to. Actually, the fact that we can detect illusions means that we as scientists are learning the fundamentals about how our brain processes sensory information.
Oh, I get it. We are basically giving our brains weird information about our environment. And from what we perceive, we can understand exactly what the brain focuses on, comprehends, and maybe prefers.
Yes, exactly.
Okay, so you tricked me and my brain pretty well with that magic trick. Do you know of any other illusions?
Yeah, there are many types of illusions. The most famous ones are optical illusions. Optical illusions are like seeing an image on a piece of paper, even though you know it's not the physical object. And we sat down with a world expert in visual illusions, Dr. Stephen Macknik, and he taught us all about our visual system.
A, D, E, F, G. How now, brown cow?
That's good.
Perfect.
I'm a professor at SUNY Downstate Health Sciences University. I'm a neuroscientist, and I'm interested in all aspects of perception and cognition, but mostly in the visual system.
These illusions are a result of stimuli entering your eyes and being computed by the visual cortex in your occipital lobe. Dr. Macknik will tell you a little bit more about that.
Your eye then intercepts those photons and focuses them onto the back of your eye where there's a light-sensitive sheet of neurons called photoreceptors. And those neurons detect the light and transmute that light source, transduce that light into electrochemical signals that then travel through the circuits of your eye, through your optic nerve, into the thalamus. A specific part of the thalamus where the optic nerve connects is called the lateral geniculate nucleus of the thalamus. It's a mouthful, so we call it the LGN. And from there, it travels through a series of wires, essentially called axons and neurons, that go back. It's the very back point of your brain, right above your spine, called the visual cortex, or the primary visual cortex.
And if I had to feel that on my head, where would that be?
If you put your finger on the very back of your head, you can feel a little knob right above your neck.
Okay.
That right under that is where the primary visual cortex is.
So it's right on the top, right beneath the skull.
It's right beneath the skull is where the central visual part is.
Your visual cortex is designed to take in information from your eyes and categorize the input so that it creates a map of what you see from each eye. Your left hemisphere of your brain actually gets info from your right eye. Weird, right?
Yeah, that's super weird. That crossing of the brain hemispheres is called decussation, and it happens in many brain systems. You also have neurons for different types of visual stimuli.
There's neurons that like horizontal, there's neurons that like vertical, and there's neurons that like oblique, of every single possible orientation. And so those neurons will actually help you see, for example, the surface of a table and where the edges are. There's neurons that help you see whether something's moving or not moving and which direction it's moving. There's neurons that are specific to faces, which are really important to humans. Mm-hmm. There's neurons that are really specific to hands, which are really important to humans. And there's neurons that are specific to certain kinds of expertise you may gain through life as well.
Your neurons are also organized in columns called ocular dominance columns, which helps our brains combine information from each eye so that we can perceive the world around us in binocular vision, meaning both of our eyes. Furthermore, in our eye, we have a layer of neurons that detect light called our retina. All of the neurons need to exit that eye somewhere, and this area is called your optic nerve. And it exits your eye in one cluster of neurons, or the axons of the neurons. Now, by exploiting how these neurons are constructed, we can look at visual illusions, and the result can tell us a little bit about how our brain fundamentally works.
Okay, so I'm not going crazy. My brain is actually working just fine.
It's working great. Okay, so here's an example of how your optic nerve actually causes an illusion.
Touch your thumbs together horizontally, okay? And put your two index fingers up. So this is like making, the football sign when you're playing paper football, right on the tabletop. So,
field goal.
You've got a field goal here. So now, again, your elbows are straight. Now, if you close your left eye and look at your left fingertip with your right eye open,
oh, my finger vanishes.
Your right finger vanishes into the blind spot of your right eye. Your left eye's closed, your right fingertip will disappear, and yet you can see what's behind that fingertip, right?
Yeah.
So, do you have X-ray vision, Danny, in your blind spot of your right eye?
Kind of feels like it right now,
You don't. I can assure you.
I definitely
Oh.
don't.
And even though it
latency
feels like you
superpowers.
can see what's behind that finger, you can't.
Wow, my finger vanished. What Dr. Macknik had us experience was part of our anatomy that we usually don't notice on a day-to-day basis. When your finger vanished, it was because of the blind spot that the optic nerve causes. But what makes it fill in with the background?
Well, that's the best part of the illusion. And it's really not 100% known about how your brain fills in this gap and creates this background. What it has to do with your visual cortex somewhat making up the information, so we're not always just seeing black space where our optic nerve is placed in our visual field. Okay, so besides vanishing fingers, there are also so many illusions that you can also try at home. Dr. Macknik has a book called Sleights of Mind. I highly recommend it. And in his website, sleightsofmind.com, also has some great examples of optical illusions. My favorite optical illusions also tricks your sensory system as well and has huge implications in medicine. This one's called the phantom limb trick. So imagine this, and you can possibly try this out at home. Maybe since Halloween's coming up, you can get a fake hand and practice this with a fake hand. Okay, so you place both of your hands on a table, but you cover one of your hands with an opaque sheet, so it's something like a blanket. Then you place the dummy hand on the table where your hand would normally be, and arrange it to look like it's kind of connected to your body. Then your trusted magician or your family member will start touching the dummy hand with different objects while you watch this hand being touched. And you know what? You might actually start feeling your hand being touched by these objects.
There is no way that would work. I would know it's a fake hand.
Well, even though you know it's a fake hand, your brain thinks it's your hand since you're seeing it. And your visual cortex will eventually communicate to your other senses to make sure you actually feel the different touches.
That is wild. How is it implicated in medicine, though? It seems like only a fun party trick.
Well, 80 to 100% of people who lose their limbs, whether that's in accidents, disease, or war, actually experience this phenomenon called phantom limb. They have reports of clenched fists, pain, burning, twisting, cramping, or aching in the limb that doesn't exist anymore. One effective treatment for this is cognitive therapy that tricks the brain to think that it's actually releasing that clenched fist or treating the invisible limb. So what they do is they place a mirror where the limb would actually be, so the patient can see two limbs. They'll see a reflection of their left hand if they still have their left hand, or a reflection of the right. And then the patient can manipulate one of their arms while looking into the mirror so it looks like both of their hands are moving. And this has been shown to be effective in relieving the symptoms of phantom limb.
Wow, that is exciting that magic and illusions may be able to help patients with medical issues.
Yeah, and there's so many more fascinating aspects of illusions and magic in neuroscience. Melissa and I talked to Dr. Macknik for a little while. So if you want to hear that entire interview, go to our next episode and you can hear the entire thing from start to finish.
Danny, I actually know about an auditory illusion. I'm going to play something for you, and you'll tell me if you hear Yanny or Laurel.
Laurel, 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 Laurel.
Oh yeah, that's definitely saying Yanny.
What? Laurel?
No, that's definitely saying Yanny.
No. It's definitely Laurel.
Those are two completely different words. I can't believe I hear Yanny and you hear Laurel. How do we know which one's right?
Well, part of this mystery was solved by changing the pitch of the audio. Guess what? When the pitch is increased, you can hear Laurel more clearly, and when it's decreased, then Yanny sounds more clear. I'm going to show you.
Laurel, Laurel. Yanny, Yanny.
So does that mean that depending on how sensitive you are to a high-pitched sound, you might hear one or the other?
Exactly. However, I should also mention that different speakers or headphones can also interfere with the frequency of the sounds and then influence which one you hear as well. So it may not all be in your brain or your ears.
Well, are there any other like factors that might influence the way that we process our words, like maybe your environment?
Oh, yes. Our brains are constantly picking up clues from the environment, and these clues can influence what you hear. So, for example, the first name that appears on the question of which sound you hear may lead your perception towards that sound. So, if the first word that you read or you heard is Yanni or Laurel, that can lead your perception towards that. But also the language that you speak and the words that you're more familiar with, or even words that you have just recently heard before that, may also bias you towards Yanni or Laurel. Now that I'm thinking about that, Denny, you don't think the fact that I heard Laurel has anything to do with my name being Lorena, right?
Um, no, probably not.
No. Yeah, but totally. Probably.
Yeah, oh, totally.
This actually reminds me of the McGurk Effect, which is another strategy that auditory illusions use to trick our brains. It's based on how we integrate visual and auditory signals to process information. I once watched a video of someone saying ba, ba, ba repeatedly. Then they replaced that video with someone saying fa, fa, fa. You know what they revealed right after? That they kept the original audio for the second video. So it was actually that same ba, 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 but I was hearing fa, fa, fa. It was crazy. And that's because we know how it sounds when you move your lips to say fa, right? F and A. So by watching the person moving their lips for the fa sound, that's what I thought they were saying, and that's actually what I heard.
Well, that's a great example of how our sensory systems work together to perceive information.
Yes, our brains are capable of detecting many stimuli at the same time in order to give us the most accurate representation of the world around us. But because of that, it can also get a little confused at times with all that information. You know when you have too many tabs open on your computer and it crashes for a second? Kind of like that. And that's partly how illusions can trick our brains.
Oh, that's a really good analogy.
Wow, we have learned so much about how our brain actually tricks us into thinking illusions are within the real world.
Yeah, we have seen that our anatomy can cause blind spots in our visual system. And our brain actually causes a different perception of stimuli depending on what we have previously experienced in our life.
We also learned how our auditory system is very reliant on our visual system, and how what frequencies are heard can change what words we hear. It is truly amazing.
Yeah, I can't wait to dig into more illusions to see if I can trick my senses a little bit more.
Well, everyone can, because we will be posting a bunch of visual and auditory illusions to our Facebook and Instagram.
Well, that's all the time we have today. Follow us on Instagram at ascend.program, at Facebook at ascendprogram, and on Twitter at program.ascend. You can also find us on TikTok at ascendprogram. If you have questions, email us at ascendneuro@gmail.com. I'm Danny Nemeth.
I'm Lorena Areal.
Signing off till next time.
Directed and produced by Dr. Lorena Areal and Danny Nemeth.
Music is by Max Sentosh.
All of this is made possible by the generosity of the Style Nicholson Foundation in coordination with Florida Atlantic University, the Max Planck Florida Institute, and the Scripps Research Institute of Florida.